Canadians continue to be frustrated with our healthcare system, long wait times and a shortage of doctors. So joining us to discuss this and more is Bacchus Barua, the Director of Health Policy Studies at the Fraser Institute and co-author of a new study called Comparing Performance of Universal Healthcare Countries 2024. Welcome back, Bacchus. Good to have you with us again.
Thank you so much for having the show again.
Okay, well, this is always an interesting topic, one that gets people's buttons kind of pushed. So maybe, can you briefly explain how the study was done and what kind of indicators were used to compare healthcare?
Sure. I think most Canadians will know that it's very obvious when they look around them that the healthcare system is crumbling and struggling. But it's really important for us to be objective and have a look at how our healthcare system is doing yearly and then also across different countries. So one of the things that we've done every year, at least for the last 10 years, is we look at Canada compared to other countries with universal healthcare and have high incomes, basically trying to get an apples to apples comparison. And I think for some people, it might actually be quite surprising that there are other countries with universal healthcare. We're kind of sold this idea that Canada is unique because we have universal healthcare, but really we're unique more so because of the way that we do universal healthcare. If we look at other countries around the world, there are at least 30 other countries that have universal health insurance coverage. So that's a total set of 31 countries. And we are looking at over 40 different indicators of performance across 4 different areas of measurement. One of them is the availability of resources. We're looking at the utilization of volume of services. We're looking at timely access to care. And we're looking at clinical performance and outcomes. And we're contrasting all of it with the amounts that we're actually spending on healthcare. The general idea is, what are we actually putting into the system? And what do we actually get out of it? We should be seeing this money at least in one of these areas. But, as we'll talk about a little bit more, we're really not seeing it translate into performance.
Right. Okay, that's a good indicator, the money. So how much money does Canada spend on healthcare compared to other countries?
So there are a couple of different ways to slice it. When we look at data from 2022, which is the most recent that we can do across all these different countries, we're spending about 11.5% of our GDP on an age-adjusted basis, which is important for us to do because different countries have different age profiles. And that ranks us at 4th highest out of these 31 countries with universal healthcare. Another way to look at it is per capita. And in terms of per capita, we're about 9th highest. And so the way that I kind of try to think about it is that whichever way you look at it, adjusted, unadjusted, per capita as a percent of GDP, we're amongst the top third spenders, regardless of which way you look at it. And that's not necessarily a problem if A, your books are balanced, and if B, you're getting good value in return. But again, unfortunately, what we are consistently finding is that that high spending is not necessarily translating into high performance.
Right. And with that amount of spending, you would expect good results. But your study is showing that Canada ranked 28th out of 30 for the availability of doctors. That's pretty disappointing. So what are some of the reasons behind the poor showing? Why don't we have more physicians? What's going on?
So this is a key area of performance that we've looked at, which is the availability of resources. And while absolutely we are ranked 28 out of 30 with physicians, it's not just physicians that we have a relative scarcity of. We also rank 25th out of 30 for hospital care beds that are dedicated to physical care. And we rank 27th for MRI machines, and we rank 28th for CT scanners. These are just a couple of examples, but I can say pretty confidently that across the board, we're definitely not getting actual physical resources and people for the money that we're spending. When it comes to volume of services, I would say that the excellent folks in our healthcare system do seem to be trying to do the best that they can with these few resources. So our volume indicators are a bit of a mixed bag. But overall, with these low resources, one thing becomes very clear, and that's that the stories that we hear about folks who can't get into hospital or hospitals that are overflowing, or folks who can't get a physician start to make a lot more sense. Why? Well, we just don't have a lot of these resources, despite ranking as one of the highest spenders. The question of why would come back to how we actually structure our healthcare system.
Wow. And, of course, without enough doctors, that obviously impacts the wait times for patients. And I understand we ranked, second worst for patients who waited more than a month to see a specialist, and the worst for patients who waited 2 months or more for non-emergency surgery. And I need to think another poor ranking was the 25th out of 30 for hospital beds and also 25th for psychiatric beds. So if we're one of the biggest spenders, why don't we have more hospital beds?
Well, I think you brought up a really important point, which is these fewer resources do have consequences, and one of them is absolutely the long wait times that we see. And to get to the answer, which I know we're trying to get to about why this is happening and who's doing better, one of the things we can do is actually we can look at some of the countries that are doing better than us. So when we talk about wait times, for example, whereas 65% of Canadians had to wait more than a month to see a specialist, it was only 36% in Switzerland and 36% in the Netherlands. And it was actually much lower in 2021 before 2020 and 2021 before we had to deal with the pandemic. Same thing when it comes to surgical care, whereas 58% of Canadians had to wait over 2 months for surgical care. In Germany, it was up about 1/3 of that. It was about 20%. In the Netherlands, it was also about 20%. And it becomes even more stark when you look at wait times across a year, for example. But this is starting to give us a set of countries that you can already see over here. And honestly, if you look at all the indicators, it's about the same set of countries that do better than us. These are countries like Switzerland, the Netherlands, Germany, France, Australia, and to an extent even Sweden and France. Sorry, I mentioned France already. But the thing is, there are 3 things that these countries do do differently.
Okay.
The first is that they have a different attitude towards the private sector. And yes, I know that's a difficult thing to talk about in Canada, but despite having a universal healthcare system, these countries see the private sector as a part of the universal healthcare system, helping to expand supply dynamically in order to actually deliver on that universal healthcare promise. The second thing that they do differently is that they generally tend to expect patients to share in the cost of treatment. Now, this is very different than taxes or premiums, but they expect sharing through like deductibles and co-insurance payments. Let's say, for example, in the Netherlands, it's about a $300 deductible. So you first pay, 300 euro deductible. Okay. You first pay the first 300 euros, and then insurance kicks in.
Oh, like it's
in Switzerland, they have. Yeah, exactly. And in Switzerland, they have like a 10% addition to that. So it says, okay, whatever you're getting, you pay 10% of that cost. But there are, of course, exemptions for vulnerable populations, pregnant mothers, folks who are chronically ill, and there are limits so that it's never crossing a certain percentage of your income. It's not meant to be a financial burden, but it's providing an important signal, which is saying that these are scarce resources that need to be used responsibly, and we need to temper demand a little bit over there. And the third thing that they do differently is that they fund their hospitals according to activity. In Canada, we are stuck with this old and outdated approach of global budgets, and that's because we have a government-heavy healthcare system. But what that does is it makes hospitals see patients as a cost, because every time a patient comes into the hospital, they're eating into that budget. Most of these other countries have realized that the way that you want to do it is you want to fund the hospitals according to activity, so that every time a patient comes in, the hospital actually gets money to treat that patient. So these are 3 sort of big idea things that these countries do differently. Of course, there's a whole lot of details, but this is really what sets us apart from a lot of the high performers.
Yeah, so we see what these other countries are doing that's better than Canada. It sounds like Canada has a lot to learn from them. In your knowledge and research, is Canada actually spending time learning from these countries on how to improve things?
There have been some small experiments in provinces. One great example was Saskatchewan in about 2010 to 2014. They tried to do what they can within the confines of what the federal government allows them to do. They partnered with third-party private clinics to expand supply. They had a central pool of patient referrals so that your GP doesn't just refer you to the specialist that they know, but you go into a central pool and you're matched with the physician with the shortest wait time. And Saskatchewan saw their wait times decrease dramatically. They went from the second highest wait times to the second lowest, shortest wait times within 4 or 5 years. But there's an important caveat. Over time, their wait times started to creep back up again. And this is the entire problem. The issue is that those sorts of things are good, but they're a first step. And they're really just all that they can do within the confines of the Federal Canada Health Act, which is, it's a financial tool that dictates transfers to the provinces. But the thing is, there are a lot of restrictions in Canada about going beyond that. But I will say this, there's a lot that provinces can do and that I think they can experiment with and should. And on top of that, there's a lot that the federal government can do to loosen the hold that it has on dictating what provinces can and cannot do by learning the lessons from these other countries.
Yeah, interesting. Do you think that we're spending too much on healthcare bureaucracy and management?
So I haven't done research on that in particular. There have been, I think, folks, particularly, for example, Dr. Rande, who's found data in British Columbia that shows that the management has expanded over time. But I think a comprehensive measurement of what's actually going on is unfortunately very difficult for us to tell because some of it is coupled into the hospital spending data in Canada rather than pushed into the administrative section. But what I will say is that there must be something going on because clearly our spending is not translating directly into the resources and into the volume of services, and certainly not the timely access to care. So there is something gumming up the works that's not resulting in the money translating to performance.
Yeah, and Bacchus, you mentioned one of the things that those countries are doing well, or they're doing differently, I should say, is privatization. And in Canada, we have a lot of resistance to the idea of expanding private healthcare options, and along with that, competition between hospitals and doctors. So, are we seeing more of that in nations with the top performance ratings? I mean, that's one of the things for sure.
I think one of the real unfortunate things that's been going on a lot in North America is that Canada, a lot of our healthcare discussions are focused on the United States, and in the United States, they're focused on Canada. And I liken this to, going to the races and betting on two horses that are not really doing well. Really, what you want to do is you want to focus on the horses that are winning the race. And it becomes very, very clear. As I mentioned, Switzerland, Germany, the Netherlands, so on and so forth. And all of them just have a different approach. Rather than saying that our system must be public and that we must preserve it as such and have that as a priority, they put the patients as a priority. And you design the system around the patients and say, okay, if we have a universal system, what we want to focus on is actual delivery of services so that we get that universal promise. So put the patient first, adjust the system around it. In Canada, we're just so focused on the opposite, which is the preservation of the system at the cost of the patient. And very clearly, patients are paying the price for that decision.
Oh, that's such a shame. We all, of course, want to see healthcare improve for us and our loved ones here in Canada. So where do you see things going in Canada over the next decade?
It's, I would say, quite disappointing to see how little provincial premiers and certainly federal governments have acted upon this. And I think there's a real lack of courage or lack of understanding. I don't know what's going on there. But I will say this, that I have a lot of hope and optimism for the average Canadian. I do believe that the average Canadian is understanding that there are other countries, and it's not just a question of Canada versus the United States of universal healthcare or not. There are other countries within this universal umbrella of healthcare that are doing a better job on delivering on that promise. We are much more aware of information out there, sometimes to do with the reports that we're doing, but also just because of that availability of information that's out there. And I do believe, and poll after poll is suggesting that Canadians do understand that our healthcare system is in trouble and reforms are needed. What those reforms are going to look like, we will have to see. I hope it's an iterative process and that we do understand, because I think everybody really is fundamentally on the same page, and that's about improving our healthcare system. And like always, I think it will be led by the average Canadian, and politicians will at some point have to figure out that's where the data is indicating we need to go.
You mentioned a lot about how these other countries are sort of operating. What about from the patient standpoint? How do we compare with health outcomes for Canadian patients compared to those other countries? And also with overall life expectancy compared to these other nations?
So we look at it, and we look at it in clinical performance, and it's a bit of a mixed bag. And why I say clinical performance is because when we just look at things like health status, things can get very fuzzy very quickly, because health status can be affected by a variety of different things, including genetic factors, gun violence, all sorts of things like that. When you look at clinical performance, it says, okay, if somebody has been diagnosed with, let's say, asthma, what are the survival rates 30 days after that diagnosis or a year after that diagnosis? And in Canada, it's a bit of a mixed bag. Or at least 10 years ago, because that data has not been updated, and that makes me a little bit nervous, we actually did quite well in terms of cancer survival rates, for example. We're closer to the top when it comes to 5-year survival rates for breast cancers and rectal cancers and things like that. But through that time, before and today, we still have very poor outcomes for things like obstetric trauma, or we have average outcomes for things like survival rates after having an ischemic stroke. So it's a bit of a mixed bag. And the way that I put it is that I think the folks in the healthcare system are trying to do the absolute best that they can with the resources, with the scarce resources that they have, but we shouldn't be putting them in that position. And the second thing is that while obviously we're trying to triage patients as best as we can, particularly these patients who need the most care, everybody else just seems to be getting swept under the rug. Folks who say, need a hip replacement or a knee replacement, which may not be as intense and urgent as let's say cardiac care. It's not like they have to wait just a couple more months or just a couple of weeks. They have to sometimes wait years in order to get treatment. So that's what concerns me over there. We're trying to do the best that we can with the resources that we have, but really what we need those resources so that we aren't having to make such difficult decisions and such drastic decisions in order to prioritize patients, and that all patients can actually get the care that they need.
Thanks so much for being with us today, Bacchus. Appreciate having you on.
Thank you for having me on the show.
Bacchus Barua is the Director of Health Policy Studies at the Fraser Institute and co-author of a new study comparing performance of universal healthcare countries 2024. You can read the entire study at fraserinstitute.org.